So I'm very honored to be here. We have lovely Yusra. She's 31 years old. She works in banking and she is also doing her PhD. The only treatment she has done previously is around her lips. I think it's very clear to see. It's interesting how people make a choice of which treatment they're going to have first in their lives. And this was the only treatment she has had. And she is a little disappointed because she feels that the filler has migrated more superiorly. You can see that. But what is most important for me is that for me it has put the face out of balance. So if we turn you to the side, thank you, Yusra, you can see that the face is not particularly balanced. Now, we have discussed, Yusra is going to Turkey next year and she's going to have a rhinoplasty surgically, okay? So we're not going to touch this today. So we need to think about facial balance. This is the most important thing as aesthetic doctors. And for me, she is very flat in the mid-face, you see? Which is making her look tired. It's also pronouncing the projection of her nose, and also it is pronouncing what has happened with her lips as well. This is the first aspect. The second aspect is if you look at the length from her hairline to the mid-brow to the subnasale, and nasale to the progynnon, she is now a little bit short here relative to the other horizontal thirds of her face. So when we are talking about harmonization, for me, when we're talking about the mid-face, it will be important for her to have some projection. It will make, you can come back to the front, it will make the eyes look less tired, and also then to give her a little bit of projection and length on the chin. You can also notice that she is a little bit asymmetrical. Can you smile for me as well? And that asymmetry is actually accentuated or made worse on this left-hand side when she smiles. So when we talk about mid and lower face balance, we have to think about the entire face. We have to think about other sub-aesthetic units and understand how we can harmonize these things together. Okay? So everything begins really with that first assessment. So we're going to clean the face and we're going to start. So this is really about beautification and harmonization, okay? And this is what we're going to do today. We're going to start with her mid-face, but we're going to start more laterally to give her a little bit of breadth. So this is very much, as I said, it is very much in the realm of beautification. For this, I'm going to use the product Restaurer Lift. Essentially, this is my favorite product, okay? It is now 30 years old, this product. It has one of the highest G primes in the aesthetic gel market. And just with minimal product, you can achieve a very nice projection, which is what we want for this young lady. So I will feel the zygomatic arch. I will pinch, okay? Just to get a feeling. I will use a needle. I've already primed the needle. Give me a big smile. You can see that she has volume here. Big smile, keep smiling. A volume here. So we don't want to give her volume here. We want to give it slightly laterally and working backwards. Okay, and relax. So in her case, it sits just, there we go. And we're going to be straight down on the bone. Okay? We inject very slowly. And you will begin to see, just with small quantities of injection, we will begin to project this area. I'm injecting deep on the bone. The G prime of this product is around 850 or so. So it has a very high G prime, and that's why with minimal product, you can achieve a lot of projection. So that's deep down on the bone. I'm going to inject 3 points, all of them deep. I'm touching once again the zygomatic arch. She is aware of that. But you notice, because the product has anesthetic, the needle we are using is a 29 gauge ultra thin wall needle. and so the discomfort is very, very minimal. In my first injection, I injected 0.4 mil. In my second injection, now, which you're witnessing, I'm going to inject 0.3 mil. Okay? And then my last one, just to give her that really nice height, once again, deep, I must touch the bone so that you are completely aware at all times of the depth of your injection. Okay? So in this case, I'm going to inject 0.2. So we had 0.4, 0.3, 0.2. That's it. So a total of 0.9 mil just on this right cheek. Okay? Very minimal discomfort, and you can begin to see already what we've managed to achieve for her, okay, compared to the untreated side. Okay, that's beautiful. So, once we have done this, we are now going to give her that anterior cheek projection that I spoke about. For this, I'm going to use Restylane Define. Okay, that's beautiful. How are you getting on, Yusra? You good? Excellent. Good. So here, I will make a little pre-hole just for my cannula. So in the first instance, as I said, I used Restylane Lift, which is a Nasha product. It's been around for 30 odd years. It stays exactly where I placed it. And this is ideal for when we are treating bone. And we're going to go on and treat her chin as well. So when we're looking at bone reabsorption, we're looking at projection, this is absolutely the ideal product. But of course, in the mid-face here, this is an animated area. We want something which is a lot softer, and that's why we're going to use Restylane Define. Okay? That's great. So we're just entering, it's going to be a 25 gauge cannula, and we're going to go once again deep onto the bone. This is really important. We're going to go into the deep medial cheek fat. Once again, I'm touching the bone. And once I have got into the correct plane, I'm going to gently take the cannula, turn slightly away from me, my dear, slightly away, that's beautiful. I'm going to take the cannula up towards the deep medial cheek fat. And you can see, hopefully you can just see the tip of my cannula, but you can also notice how deep it is, okay? So this is under the muscle, beneath the deep medial cheek fat. And I'm going to give retrograde threads, okay, of product. And we know that this product integrates very nicely with the tissues. And so when she smiles, we will notice that the product will not move because the product is injected deep. The product is injected deep, and also it is beneath the muscle. When a product is beneath the muscle, just losing a little bit of sight here. Can I just have a fresh gauze, please? Thank you so much. When the product is beneath the muscle, we will notice that she is able to smile without any projection. Because what we don't want to see is when she smiles, we don't want to see that look. Can you just hold on to that for me? We don't want to see that look where she looks like a chipmunk. Okay? We see that all the time. The patient may look good at rest, and you think, okay, this is a good result. And when they smile, they look slightly odd. And the way we avoid that is by injecting deep, which is what we're doing here.
Okay, that's wonderful. Clarification about my next session.
Thank you.
What do you mean?
That's great. So this is Restylane Define. As I said, this product wants to integrate with the skin. It is a very soft product. And once again, we're going deep onto the bone.
What do you mean?
Just there. We're taking the cannula up.
I know for sure
That's
the
it.
next is the tear trough. So okay,
and
perfect.
this is the cannula tip.
Okay,
so with my non-injecting
what is
hand,
this area?
I'm able to control
what do you mean?
exactly where
Cheekbone,
the filler is
this
being
area?
placed.
I don't know.
Okay.
Yeah.
Tiny retrograde threads, and
What?
of course, when we fill the deep medial
Yeah,
cheek
because
fat,
cheek junction, I mean,
it will
could be
support
this area,
the
could be
orbicularis
maybe
retaining
this
ligament, which
this one,
means
this one,
that
I
the
don't know,
tear
it's,
trough will
is this, I
also
don't know. So.
be partially corrected. So normally with a patient like this, I will treat the mid face and the lateral face, and then I will bring her back for review, and if we need, then we will treat the tear trough. But often, you don't need the tear trough treating. Okay, you can see I'm very deep, the tip of the cannula is here, and we are just giving retrograde injections. And here I will use a total of about 6 or 7, 0.6, something like this, to give her that nice projection. Don't forget, we're trying to create that really nice balance for her between her mid-face and her lower face. There we go. That's excellent. Thank you so much. Well done. Good. There we go. And smile for me. Great. So notice we haven't given her any too much over projection, and when she smiles, everything stays exactly where it is. Okay? So just a gentle massage, that's all that's needed. Wonderful. So if you just sit up for me a little bit, that's it, perfect. And you can really begin to see the difference between the two sides. She already looks less tired around by the eyes, and certainly less flat, and you can see that projection very clearly. A view that I like to use, and I even photograph my patients, is an aerial view. So coming from above, looking down, because of course we see patients in 3 dimensions, as does the rest of the world. So it's important to remember that we're not just working in 2 dimensions, we're working in 3 dimensions. That's wonderful. It's just a little bit wet. So we're going to continue by treating the area now around the chin. As I explained, I'm doing this because I want to balance what's happened with her lips, and we want to make this a lot more congruent with the mid-face. Okay? So, and she has a little bit of asymmetry. So on this left-hand side, she has a little bit of flattening. So there's 2 things I want to do for her. I want to give her a little bit of projection, and I want to give her a little bit of elongation, and the elongation is to balance the horizontal thirds and also to offset the lips a little bit, okay? So it looks a lot better. Turn slightly towards me. That's wonderful. You can see everything there, and you can see this beautiful projection here compared to the untreated side. You can still see everything? Good. So just in the midline, I'm going to start. I'm pinching the skin with my non-injecting hand, my index finger and my thumb, and I'm going to place the needle just at 45 degrees, once again deep on the bone. And because we're looking to replace bone reabsorption and beautification, but deep on the bone, I'm going to use a product with the highest G prime. So with this, we're going to get a little bit of projection, and we're going to get a little bit of lengthening. Okay, so you can see the angle there at 45 degrees. And you place the filler once again very deep, and you hold it exactly where you want it to be. You can see it's also slimmed the chin a little, turn this way, and given her a little bit of length. So once again, a much nicer, what I call congruence between the mid-face and the lower face, okay? And you can see when I place the filler, I place slightly off-center to give her that balance on the left-hand side, but I think she needs a little bit more there. So I'm going to do that right now, okay? So once again, a deep injection on the bone. Remember, she had a bit of asymmetry on this left-hand side. In the first point, I injected 0.4 mil in the center, and in the second point, I'm going to inject possibly about 0.3, okay? It's deep on the bone. It's beneath the muscle. There we go. And the product will not move. It stays exactly where you place it. We've done many cadaveric studies to show that this product stays exactly where you place it. Whereas this product wants to integrate into the skin. It wants to spread, the define, but that's exactly what we want to take advantage of. Great. So let's have a look at that result before we inject the last little area for her. Just turn here, and you can see very clearly a much nicer confluence between the mid-face and the lower face. Okay? Just into the center there. And if you just turn towards me, there we go. Just to show you, there we go. So you can see what's happened to the chin there. It just balances here, and also it balances, giving her a little bit of length compared to what was happening in the upper and the middle two-thirds. So once again, more balance, particularly with what happens with her lips. If you just turn to the side again. So the last thing for her actually is we're going to inject deep in the piriform fossa. And we're going to do this with restaurer lift, just to give her less of the base of that piriform fossa is sinking a little. It's giving her the root of the nasolabial fold, and we want to improve that for her. Okay? So we're going to inject deep on the piriform fossa. Once again, we're looking for bone reabsorption, so the product of choice is going to be restaurer lift, because we're looking to project. Okay? I inject at a 45-degree angle, little scratch, well done. You can see. It's, once again, it's a deep injection, because don't forget we have the artery here, which is often in a more superficial plane. And you can see what's happening with the skin as we're getting the projection that we absolutely expect. Now, when I do this for patients, particularly at this point, I will warn them, because of the local anesthetic, she may notice that she has a little bit of numbness in her upper lip. This is very normal, okay? Excellent. Very good. So just a very gentle massage. Are you feeling the numbness? Yes, exactly. This goes away after about 1 hour, maybe about 45 minutes or so. So once again, a very clear improvement, and you can see very nicely this contour of the mid-face, the lateral face, and the chin. There's a better balance here. So I'm going to treat the left side now. I'm good. If we can finish now, or I can treat the left-hand side. Yeah, it's fine. Yeah. 5 minutes okay? Great, excellent. Always difficult to showcase everything, but we will do everything we can. Okay? Good. Right, so I'm going to go around to the other side, because everyone always just sees one side injected. We'll try and do the other side. So you can see she's a little flat. We're going to cleanse the skin to begin with. Okay? And exactly the same principles will apply. We're going to use resting. Thank you so much. That's wonderful. Okay, your head is nice and comfortable. I always ensure that I inject my patients sitting upright. This is absolutely vital, really important, because obviously the tissues are moving when the patient is lying flat. Big smile. Excellent. You can see where we're not going to inject. We're going to inject slightly lateral to that to give her that lovely apple, and relax. Okay? Let's see if we can do this without obscuring too much. There we go. There we go. That's deep on the bone. Okay? And we're going to inject here. You can see by the patient's eyes that actually she's very relaxed, given the fact that she's never really had many injections before. And if you remember, we injected 0.4 mil on the other side, and we're going to do this exactly the same on this side. And you can actually see the projection and the height of the cheek beginning to take shape. Okay? Deep
Thank you.
injection.
Thank you, Dr. Kuldeep, but you have 2 minutes more.
Okay, wonderful.
Okay.
There we go. Once again, a lovely deep injection. Okay. And this time it's going to be 0.3 mil, if you remember. Always watching the patient, and you can see how we've managed to really give her a beautiful projection laterally. I'm just trying to do this so that you can actually see at the same time. Okay, wonderful. And the last one, 0.2 mil, as we discussed. Perfect. How are you getting on? So you okay? Yeah, great, excellent. Always good to make sure your patient is still doing okay. So I'm going to take the, just a little pre-injection. Wonderful, good. Big smile, relax. So we're just going to do that little pre-injection here. And we're going to use our 25 gauge cannula. Thank you, and we're going to use Restaurer Define. Thank you so much. Good? Excellent. Good. Excellent. So, once again, deep on the bone. This is really important. There we go. I'm on the bone. She knows. She felt it. But it's important to be at the correct plane. This is how we don't get over-volumization. This is how we don't get the patient, when they smile, they look as if they're a chipmunk, because everything is beneath the muscle. Look how deep that cannula is. My cannula tip, this is going to hurt a little bit because we're getting close to some of those little ligaments. Okay, my cannula tip is literally here. And you can see, I think the young lady who is assisting me can see where the cannula tip is coming. Oh, okay, it's come loose. Have we got some more Define? If we've got another one of Define, that'll be good. It's just come loose from the cannula. Okay, no problem. No problem. Good. If we've got a fresh cannula as well, that'll be great. That's great. Good. Excellent. That's it. I think there's a fresh cannula. Yep. Yep, 25 gauge is fine. Okay. Good. Great, thank you. We're back in the room there? That's wonderful, thank you. Good. Excellent. So, that's it, head is nice and comfortable. I like to have the bevel down, okay? You can see the bevel of the cannula. I like to have it down so the product stays deep, okay? It's very important for me that the product stays deep. We're deep on the bone. We're going to traverse superiorly here, and we're going to begin to inject, okay? That's it. And you can just see where we're beginning to create that volume. I'm not going to use my hand here, I know, because it obscures your view. That's excellent. But you can begin to see how we're just going to give her that nice projection. And of course, what that does, it also reduces the lid cheek junction, which is exactly what we're trying to do for her as well. Okay? And as I said, when I review her in a few weeks' time, and we allow all of this to settle, she may need a bit of work in the tear trough. She may not. We will see. Good. And you can see very clearly where we're injecting and how it's giving her that anterior cheek projection, particularly when she is viewed in profile. Okay? So I'm going to take the last little bit of Restaurer lift. I'm going to inject that in the piriform fossa. Could you pass me the Restaurer lift, please? There should be a little bit of lift. Yeah, a little lift. That's it. Perfect. And she just has a tiny bit of Restaurer lift in the piriform fossa. That's wonderful. Okay, and you can see the difference between the two sides very clearly, even in the piriform fossa. Deep injection, 45 degrees, but the needle tip is going to end up just here, okay? So although I'm approaching at 45 degrees, like this, there we go. She knows it's a deep injection. She can feel it. It pinches a little bit. But of course, the idea is that we avoid the artery. We go underneath the artery, and we go medial to it. Although one can never be sure, of course, where the artery is sitting, and that's why doing the injection like this maintains maximum safety. That's fine? Excellent. That's perfect. Thank you so much. So we can have a look very clearly what we've managed to achieve for her, a much better balance between her mid-face and her lower face, an improvement in the asymmetry there, and I think she'll be very happy. Give me a big smile. Excellent. And you see her smile hasn't changed, which is very important because we injected very deep. Okay? Wonderful. Thank you, Yusra, and thank you so much.
Thank you.